Dr. Sasha Kramer, and I'm the co-founder and executive director of Soil, a sanitation service provider in Haiti. Over the past decade, there's been a surge of interest in the potential for private sector approaches to achieve the Sustainable Development Goals for water and sanitation. This focus on private sector solutions has brought about tremendous innovation and led to the development of new technologies and services designed to increase dignified access to water and sanitation while generating revenue from users. I would say that this shift in approach has served the sector well in forcing providers to familiarize themselves with the costs of service provision, increase efficiency, be creative about revenue generation, and be more responsive to client needs. But the flip side of this increased focus on business outcomes is that the pressure to increase cost recovery often directly conflicts with efforts to increase access to services for vulnerable populations. We need to be more thoughtful about how we pursue the public sector mandate to provide access to water, sanitation, and hygiene for all, while still leveraging the strengths of the private sector to ensure innovation, quality, and adequate operations and maintenance. For example, we need to radically rethink the way that subsidies are provided in the WASH sector. The way that subsidies currently work is that they are overwhelmingly applied to piped water and sewers, a luxury which most vulnerable communities don't have access to. For the past 3 years, Soil has been in active discussions with international financing institutions and the Haitian government to structure a public-private partnership model whereby development banks provide financing to the government, which can then be used to subsidize private sector service provision for the most vulnerable. In some contexts, government will be able to work directly with service providers without the need for a third-party financer. However, in the case of fragile states like Haiti, where public sector resources are extremely limited, development banks can provide the financing necessary to bring basic services for the poor to a scale where the unit costs are reduced to the point of affordability for the public sector. The challenge that we've faced is that this requires a rethinking of financing away from capital-intensive investments and towards ongoing operational subsidies. Although it's clear that the provision of dignified water and sanitation services to vulnerable populations will require the combined resources of the public and private sectors, we're cognizant that these resource pools are limited, which means that we need to continue to have innovative thinking around revenue generation. As such, Soil is also actively pursuing partnerships with other sectors to encourage the mobilization of financial resources to pay for the positive social and environmental externalities of WASH service provision, from climate financing to agricultural subsidies for reuse products. We are deeply grateful for the work of Sanitation and Water for All in bringing together a broad alliance of actors from the public sector to the private sector to civil society, and for the work that SWA has done to raise the profile of sanitation in sectors outside of our own. Ensuring basic human rights for all requires strong alliances, and SWA's work to build coalitions has been invaluable in elevating the importance of water and sanitation for the health, safety, and dignity we all deserve.